The cervical spine consists of vertebra C1 to C7 and sits on the, or attached to, the occipital condyle of the skull. The vertebrae are capable of moving the head in flexion, extension, lateral flexion, which is bending from side to side, and rotation. The axis and atlas bones are connected to each other by the dens inserting into the tubercle on the posterior arch of the atlas. That's here. The dens is what acts as a pivot to allow the atlas, which is attached to the head, to be able to rotate on the axis, so from side to side. The two lateral masses support the weight of the head. On top of each are superior facets, which are concave and slightly diverge to the posterior angle of the atlas bone. The inferior facets, which articulate with the axis bone, are flatter and circular, or more circular than the superior. The vertebral foramen is the hole which the spinal cord and the dens, or odontoid process of the axis bone, sit inside and pierce the atlas bone. And the transverse processes project laterally downwards from the vertebral foramen and the body of the atlas bone. And these are attachment sites for rotator muscles of the head. The transverse processes also contain foramina for the vertebral artery to pass through. The intracranial region has 3 fossa within it. These are depressions in the floor which house parts of the brain. The anterior, the middle, and the posterior. The anterior consists of the frontal bone, the ethmoid bone, and the lesser wing of the sphenoid bone. Remember, that's the bit that pokes down just around here and here. The middle cranial fossa consists of the sphenoid bones, or the sphenoid bone, and the pectorous part of the temporal bone. This refers to the pyramidal part of the temporal bone, wedged in at the base of the skull between the sphenoid and occipital bones, so the bit around the ear canal opening. So that's the middle cranial fossa. And the posterior is mainly made up of the occipital bone and some of the temporal bone. The stella turcica is a saddle-like prominence crossing the midline on the superior surface of the sphenoid body, and this contains the pituitary gland. Imagine how this sits just anterior to the midbrain, the pons, and descending into the spinal cord, which will eventually go through the foramen magnum. To review, the large fossa here is the carotid fossa, carotid canal, and here at the back, the jugular foramen. Here you can see the cribriform plate, which is part of the body of the upright projection from the ethmoid bone, which I described earlier, called the crista galli, which is where the falx cerebri attaches to the skull. There are 3 meninges, which are the membranes that go around the brain on the inside of the skull. Imagine that you have skin and periosteum on the outside, then going through to the bone. Immediately inside the skull you would have 2 layers, the periosteal layer and the meningeal layer. These 2 layers, the periosteal layer and the meningeal layer, make up the Dura Mater, which is the outermost of the meninges. The Dura Mater is made up of collagen fibres acting as a mechanically protective covering. It's tougher than the other two layers. There's a subdural space, followed by a web-like arachnoid layer, called arachnoid because it's very weak and delicate, and web-like, like a spider. After a subarachnoid space, you'd find the Dura Mater, which is the innermost membrane, continuous with the surface of the brain itself. The middle meningeal artery is the largest of the paired arteries supplying the meninges. It's a branch of the maxillary artery. So this is the external carotid here. You have the maxillary artery coming off towards the maxillar bone. The middle meningeal artery branches up here before splitting into posterior and anterior branches. And the point at which it passes through the bone itself here is the Foramen Spinosum, located on the sphenoid bone, just lateral to the foramen ovale. It also carries the meningeal vein, the posterior trunk, and the meningeal nerve, which comes from cranial nerve 5. Looking from the outside, it runs beneath the level of the pterion process, which is the point on the side of the skull where the parietal, temporal and sphenoid bones meet together. So if you want to locate it on the skull, it's directly beneath this pterion, which is quite a thin area of skull. And that's the anterior branch, so strictly speaking, it's about here. To actually locate it, you'd place 2 fingers on top of the zygomatic arch, like this, and a thumb down the side of the frontal process. It'll be the gap in between. That's the pterion, and that's the location superficially of where the anterior part of the middle meningeal artery runs.